Good morning and good afternoon, and welcome and thank you for joining on this event. This event is done in partnership with DNDi, Malaysia Ministry of Health, World Health Organization, and Malaysia AIDS Council. And it's part of a series of events that are happening all over the world in honor of World Hepatitis C. Each year, the momentum around World Hepatitis Day grows, with the increased awareness of the burden of viral hepatitis, as well as increased awareness and actions to tackle the hepatitis issue. I'm Saniel Schulten. I'm hepatitis lead for FIND, the Global Diagnostic Alliance, and I am so honored and grateful to be able to be facilitating this event. We have a wonderful series of speakers and panelists for you today. We'll start off with 3 high-level keynote speakers. Then we will go to a short video on community perspectives towards one of the innovations to help tackle hepatitis C self-testing. Then we will have an interactive discussion with some of the key players in the hepatitis response for Malaysia, followed by perspectives from Malaysia AIDS Council, and a wrap-up and tie-up of all of the things we've learned today. As we know, the COVID-19 crisis has really impacted a lot of all our health systems and our world. And a lot of the progress that has been made towards eliminating viral hepatitis has faced some challenge because of COVID-19. So one of the things we will do today is we'll hear the progress and the successes that Malaysia has made on this hepatitis journey. We'll hear some of the challenges and obstacles that we will have to overcome to reach where we want to go. And we will hear about some of the innovative new technologies and approaches that may help us get there. So it is my great honor and pleasure to introduce Tan Sri Dato Seri Dr. Noor Hisham Abdullah, Director General of Health Malaysia.
This year's theme is Hepatitis Can't Wait. With one person dying every 30 seconds from a hepatitis-related illness, even in the current COVID-19 crisis, we must not wait to act on viral hepatitis. Hepatitis C is a huge public health problem, including in Malaysia, and we did not wait. We took action, worked with partners to implement and develop a strategy that would enhance our elimination efforts. Malaysia has developed a national strategic plan to confront hepatitis C, and we continue on our path to fill any blind spots so that we can eliminate hepatitis C by 2030. The World Hepatitis Day is an opportunity for us to further increase awareness and encourage and facilitate prevention, diagnosis, and treatment. World Hepatitis Day for the World Hepatitis community to unite and share our work and efforts. It is also an occasion to acknowledge the progress we have made in Malaysia. Our will has never faltered, and I am very proud of what we have achieved nationally since we began our journey on hepatitis C. Malaysia is at the forefront of a partnership that developed a new treatment combination for hepatitis C virus. The National Pharmaceutical Regulatory Agency of Malaysia granted a conditional registration in June 2021 for a safe, effective hepatitis C treatment developed by a public-private partnership, bringing together the Malaysian Ministry of Health, non-profit research and development organization DNDi, Egyptian pharmaceutical company PACO, Malaysian pharmaceutical company Pharmaniaga, and the non-governmental organization MSF. The new drug, Ravidasvir, is the first hepatitis C drug that developed through South-South collaboration and with support from the non-profit organization. Our hope is that this drug will become an additional affordable option for millions still waiting for access to life-saving treatment in the middle-income country. Let's not forget that one thing is unique with hepatitis C virus. There is a cure. Ladies and gentlemen, hepatitis C virus is a blood-borne virus transmitted by exposure to small quantities of infected blood. It is one of the leading causes of death and disability across the globe. Hepatitis C is known as a silent epidemic because 3 out of 4 people do not know their status, as hepatitis C is largely asymptomatic. World Health Organization latest data reveals that There are about 58 million people infected with hepatitis C around the world, and 250,000 people die every year. Worryingly, as of 2019, just 21% of the individuals with hepatitis C infection worldwide had been tested, and approximately 1/4 of the diagnosed individuals had been treated. 70% of the people affected will eventually develop chronic disease. 15 to 30% of people with chronic hepatitis C develop liver cirrhosis within 20 years, and if untreated, may die. There is a disproportionately high burden of hepatitis C in lower middle income countries, and another reason why we cannot wait. Ladies and gentlemen, Malaysia has big ambition for hepatitis C, and we want to seize the potential and do what we can to eliminate this public health disease. We have a cure, and we refuse to accept that so many people may die every year due to this infection. WHO strategy is to eliminate the disease by 2030, but only 10 to 15% of the affected population had access to treatment globally. Not many countries are on track to reach these WHO goals, but Malaysia wants to reach this target, and we are putting our efforts to meeting this target. Despite these challenges, Malaysia has made great strides in hepatitis C. We are actively screening and going out into the community to find the patient where they are. This is an ongoing effort as seen in the Ministry of Health, FIND, and DNDI Head Start study, which catalyzed the decentralization of screening and treatment of hepatitis C to the primary healthcare clinics. Taking to the important step to boost access to affordable hepatitis C treatment in two ways. One, by negotiation with the pharmaceutical companies and using the law to ensure affordable access, and we have been very successful. Two, by finding a sustainable solution, the development of a new affordable drug of hepatitis C, the approval of ranitidine by National Pharmaceutical Regulatory Agency in Malaysia in June 2021. This combination of increasing access to testing and cure is fundamental to our efforts to reach WHO goals, reduce infections, decrease death, finding the missing millions, and diagnose patients, and treat almost all eligible patients, putting us on a path to eliminate hepatitis C by 2030. We will hear later from our esteemed WHO colleagues on their recently launched first recommendation of hepatitis C self-testing that should be offered as an additional testing approach. After the decentralization, Malaysia is now exploring how to further increase access to hepatitis C testing. Malaysia is proud to be one of the first countries in the world to embark on a hepatitis C self-testing pilot program to expand access to hepatitis C testing to those who may not be reached by facility-based testing, another feather in the hats of Malaysia's commitment to hepatitis C elimination. Self-testing will allow us to decentralize hepatitis C testing and treatment to as close as possible to the people in the community, and they will stop falling through the cracks. It is additional tool option that we can use to ensure equity in our hepatitis C response. Ladies and gentlemen, Malaysia is proud to be at the cutting edge of innovations to tackle hepatitis C, and all this is possible because of strong political will. We cannot sit on our laurels when we have the tools and a cure in hand for the hepatitis C disease. It is time that we turn the table around on medical research and development in the lower middle income countries. We cannot wait for others to take care of our own problems. We need to find our own solutions. We need to take responsibility, whether COVID-19, dengue, malaria, or cancers. Partnerships as demonstrated on hepatitis C can bring the solution that we need at a price that we can afford. And we have to work with partners and pooling our collective expertise to meaningfully share the know-how and decision-making with us. This is the way forward in the 21st century. Ladies and gentlemen, let us not wait for others. Let's do it together. And I thank you.
Excellent. Thank you so much, Director General, for that excellent opening remark. Now it's my pleasure to introduce Dr. Meg Doherty, the Director of Global Hepatitis and STI Programs at World Health Organization. Over to you, Dr. Doherty.
Thank you very much. And I'm going to use this opportunity to present a very small presentation that we hope will set the scene for the discussion today. And I just want to make sure, Sonia, that the full slide is up.
Actually, I think you just need to reverse it very quickly.
Thank you. Okay. Thank you very much. And I'm really pleased. Good morning, good afternoon, Excellencies, ladies and gentlemen. Very pleased to be with you this afternoon and this morning. And the 2021 Global Report on HIV, viral hepatitis, and sexually transmitted infections took stock of the progress achieved over the last 5 years and the setbacks caused by the pandemic and the lessons learned for the coming decade. And what we know is that we have, for hepatitis B, 154 million people living with these infections, 800 new infections per day. Regarding hepatitis C, which you already heard from Your Excellence, the Minister of Health, we have 58 million cases globally and quite a bit of variability across the different regions. And although the extent of the progress in hepatitis response has differed drastically between regions across countries, there's some notable successes, and including the impressive progress with large-scale expansion of hepatitis C treatment and the reduction of hepatitis B infection among children. The latter is one of the few sustainable global health targets that's on track and is a critical intervention for the prevention of liver cancer as we move forward. In our report, you will note that the new estimates indicate that hepatitis C now has more than 9.4 million people receiving the treatment. And this is still, though, far off from a goal of 40 million people that we want to have to reach the 2020 targets. And we need to reduce our new infections by 90% and deaths by 65% by 2030. So although it looks like we're doing quite well on this trajectory, we have a ways to go. And when we look specifically at hepatitis C testing around the world, we know that we only have 21% of people who have been identified and know their status. For the region of the Western Pacific, we're at 25%, and only 10% of those are getting onto treatment. So following the trajectory over the cascade is going to be very important as we move forward. And what you heard already from His Excellency is that Malaysia is taking on the mantle to start with new hepatitis C self-testing recommendations. And we're so proud to have been able to launch our new self-testing recommendation at the sides of the IAS conference just a week ago. And it is a strong recommendation that self-testing should be offered as an additional approach to Hep C testing. And it's part of self-care approaches, is an effective way to increase access, and it is efficient for many programs. It offers a tool to help programs close that testing gap, as more than 3/4 of the people with chronic Hep C do not know their status. And by reaching more people with chronic Hep C, we can really enhance the elimination goals, which is a global priority and also a local priority in your region. Knowledge about hepatitis C and the availability of testing, prevention, treatment, and cure remains an important area to continue to work to raise awareness. And Hep C self-testing is one approach that can help us ensure the messages and the information reaches those most effective, really democratizing testing. What we do know is that self-testing is part of a process, and it requires that once a self-test is identified, there's further testing that goes on with this so that there can be clinical assessment and movement into a treatment setting. Certainly, we've learned many lessons from the HIV that can be leveraged for the hepatitis C programs. And it's important in engaging both innovative service delivery models, as well as community groups, key populations in the design and in the implementation of these approaches, and supporting packages that can facilitate between testing and linkage to care. And what we see here is there can be many locations where self-testing could be initiated in the facility and the community through secondary distribution, online, retail outlets, faith-based sites, as well as work police programs. So we believe that Malaysia has been a real pioneer in developing both a virtual platform for self-testing and for also working to expand this testing as we move forward. They have had a platform for HIV that is now going to be available for hepatitis C. So we can congratulate them on that effort. So overall, it is really wonderful to have early adopter countries like Malaysia leading the way with policy development and implementation of hepatitis C self-testing. We've learned from the HIV that these early experiences accelerate effective scale-up and implementation, and both can be a model for the region and for the globe. By making these steps now, future WHO pre-qualification of self-testing products will be able to quickly become available, and lessons learned will be able to be applied to achieve the rapid targets we're looking to achieve. We look forward to learning from Malaysia's early experiences, as this program can help guide other programs as they scale up. And as you heard earlier from His Excellency, you've already done quite a bit of work, moving from an increase of 100-fold in your testing already. And this brings another tool, another opportunity to expand access even further and to help Malaysia to say that they're reaching their 2030 targets and goals. And we at WHO are really proud to stand with you and work with you as you move forward. Lastly, just want to encourage you all to join us for our Global Hepatitis Talk Show that will be happening tomorrow and on World Hepatitis Day. We're really proud to be able to be talking about Malaysia and their hepatitis C goals. Thank you very much.
Thank you so much, Dr. Doherty. We really appreciate you providing kind of critical foundational knowledge to global perspective, as well as where Malaysia fits within this larger journey. And now it is my pleasure to introduce Dr. Bill Rodriguez, the CEO of FIND. Over to you, Dr. Rodriguez.
Thanks, Danielle. Good afternoon and good morning, colleagues and participants. A special welcome and thank you to our colleagues at the WHO, and DNDI and the Malaysia AIDS Council, and His Excellency the Director in this important discussion. As many of you know, World Hepatitis Day as a public health campaign is only 10 years old. It was established by the World Health Assembly in 2010 to raise awareness, especially hepatitis B and hepatitis C. And it came about only because of the dedication of individuals and organizations working together with the leadership of the World Hepatitis Alliance to help hundreds of millions of people whose lives have been and now dedicated to the goal of eliminating hepatitis by 2030. FIND is the Global Alliance for Diagnostics, and our mission is to ensure equitable access to reliable diagnostics around the world. So the types of partnerships and alliances that have led to World Hepatitis, our partnership with the Ministry of Health, we've been truly privileged to be a part of Malaysia's exciting and profound journey in addressing the scourge of hepatitis C in the country and demonstrating to the rest of the world how to confront, diagnose, treat, and ultimately eliminate through close partnership with the Ministry of Health and its partners. R&D, product development, clinical trials, and ultimately the creation of programs that increase access to testing and treatment for all people at risk for hepatitis C.
Okay, thank you. And it seems like we may have been able to resolve some of those technical issues. So we will now be continuing on. So now it's my great honor and privilege to have a mediated discussion with two of the critical players for the hepatitis response in Malaysia. The Dr. Nazila Harazani Binti Nasir, Deputy Director, Primary Health, Family Health Development Division, Ministry of Health, and Dr. Mohammed Razi Abu Hassan, National Head of Gastroenterology and Hepatology Services for the Ministry of Health. So first off, I'd like to thank both of you very much for being able to make time and joining us today. My first question is to you, Dr. Razi. So the current successes and challenges in the national program to identify those infected with hepatitis C, can you talk a little bit about what those successes and challenges have been?
Thank you, Sonia, for the questions. Well, if I want to share with you the biggest success which I've seen so far, I think Malaysia has managed to provide what we call the easy access, available diagnostic for the patient with hepatitis C through what we call the decentralization. I think this is probably the biggest success which I've seen so far, because as we mentioned, I think by diagnosing patients from the community with hepatitis C, that will lead and link to the treatment. And we are very fortunate because in Malaysia, the testing as well as the treatments are available, they are accessible. And after all, I think not many countries in the world which provide a free treatment, basically, diagnostic as well as free treatment. So this certainly will promote the testing as well as the treatment. And I would like to quote again what Dr. Rodriguez mentioned just now. We have seen that before the era of the DAA until now, there are about more than 100-fold increase in terms of the number of the patients. So this is fantastic. I mean, it's a great achievement, and I'm sure this cannot be done without a very good teamwork, not just by the Ministry of Health together alone, but also with the collaboration and partnership with many stakeholders. This will include our FIND, the NDI. Remember that we have a FIND project, the Head Start, that was started in 2018, and from there, it has proven this is the way to go, the decentralizations, and we have seen now that the fruitions of what we had done, the project together with the FIND and also with the DNDI. And also, I would like to mention that it's not just the collaborations between the outside the Ministry of Health, but also within the Ministry of Health, as well, between the hospitals and also within the public health, and as well as with the other sections, for example, the laboratory, as well as the pharmaceutical. So we have proven, we have done it, and this is the result. Okay, so this is of course there are challenges, but maybe what I can mention one of the biggest challenges that we are facing right now. Number one will be that how are we going to reach out those who are still so-called the missing millions in the community? At the beginning, it was very easy because we have quite what we call the low-hanging fruits patients around our cohorts. So easily available, so we treat them and we do the screening, testing, that's done. But now I think the next stage is to look for the patient, to search, especially the key population still at large in the community, undiagnosed, how to bring them to us. And many of them are not comfortable coming to our health facility. So these are the people, and other challenges perhaps, I think, how also to get access to the people who have hepatitis C in the correctional setting, things, for example, like in prisons, in rehabilitation center, and also I think beyond the public health setting. I'm sure there are quite a number of patients still with the private sector for some reason, probably because of the costing. So we have to find ways on how to access them, to bring them back to the system and get them screened and treated. I think that's probably the biggest challenge which I can think of right now.
Great. Thank you so much, Dr. I think you brought up several really important points, highlighting the great progress that has been made, but then also highlighting some of the challenges to be overcome, particularly in identifying people, who may not feel so comfortable attending to facilities. What I would like to know from Dr. Nazila is, on that note, if you could explain a little bit more about what has been established within the Malaysia primary healthcare environment to overcome some of these barriers that Dr. was just mentioning, not just for hepatitis C, but for other related diseases, such as STIs or HIV. Oh, Dr. Nazila, I think you might be on mute.
Can you hear me now?
Yes, thank you.
Yes. So good afternoon, and thank you, Sonia. Thank you, everyone, for being with us today for this session. Yes, I think what Dato has aptly described about what was the success and what's the current challenges, and I would like to bring back about how what has evolved that made us became to be able to get some of those what we call as the low-hanging fruits. It's because of the programs that was before, that many years ago, that was introduced services into our primary healthcare clinics. We are the clinics at the first point of contact with patients, and we are very accessible to the community. And here, it was decentralized, as what Dato has just said, where treatment to diseases or infections like HIV, STDs were then, being able to be offered at our primary care clinics. Hence, patients in the community are able to access services nearest to their homes. They do not have to go to far away hospitals, and we worked very hard to educate our healthcare workers and the communities on destigmatizing these conditions, because people don't want to come for treatment because they feel that they are being judged or they are being stigmatized. So we need to do that first. And I think this destigmatization process or movement has gathered a lot of interest. Our public health colleagues also helped us in this together with our NGOs, and hence people then get, they know that they are able to get access to services. So from here, we then go for our testing. We had difficulty also with HIV testing because all tests needs to go to the hospitals, and we take a long time to get back results. And the same thing goes with our hepatitis C testing, because all of this, the patients that come to us with risk factors, we tested them for hepatitis C. However, at that point in time, nothing much could be done. We only have antibody testing that we need to send to the hospital. They had to wait months for results, and we could not, do much for them. With the current situation and the current treatment of modalities that's available, we now could offer. Now, to now change their mode of thinking. There's no treatment, expensive treatment. Now we can say, yeah, there is treatment, and it's affordable. And for Malaysia, for our people, it's really accessible, and for those who come to our clinic, it's free. So we need to change that mindset and bring them back to us. And with this, and with the cooperation with, as I say, with the hospital specialists, our hospital colleagues, our public health people, and our NGOs that comes to us, so they will bring this message to the people on the ground. So the low-hanging fruits that we had was that we had a group of patients that were already on our follow-up. That's already been brought to the cooperation with the NGOs that bring our patients to us, and we have clinics that have these NGOs working hand in hand with our healthcare workers. So those are our low-hanging fruits that we can easily get to the patients. We can talk to them, we can convince them, they know who we are, we know who they are. And because of that testing that was made very easily available in 2018, and we have scaled it up. So that really reduces the anxiety and the problems of cost. The patients need to go far, they need to go treatment for testing. So we reduce the cost for transportation. So they're able to know that they are having the problem, the disease, and they know that there could be treatment, and we are referring them. So this was the low-hanging fruit, and that this was one of our success. And with the cooperation, as Dato has said, it's really teamwork with all that that we have with all our partners, the NGOs, our public health colleagues, our hospitals, DNDI, FINE, all of us actually work together on this, and this is where we had come. So our next challenge is how to get to those that do not access our service. So that is, I think, what is the current exciting new thing that we are trying to do here.
Great. Thank you so much, Dr. Nazila. I think you bring up several really important points. I think one of them is the catalyzation and enabling the primary healthcare clinics to be that one-stop shop for hepatitis care, bringing it close to the patient so they can easily access it, and as you said, for free. High quality treatment and diagnosis all in one package. I think another really important part that you mentioned, and several have mentioned, is the importance of partnerships. So across the different departments in the Ministry of Health, but also those critical partnerships with communities and NGOs. And then I think underpinning all of this is the drive that you have led and achieved in providing destigmatized, or rather stigma-free health service delivery at the primary health care. So kind of following on that note, Dato, I would like to get your thoughts about what the impact of this hepatitis C self-testing study, how do you see it impacting on the national program? Oh, Dato, I think you might be on mute.
Okay, this is very exciting, the self-testing for hepatitis C. I think that the first one, it gives the opportunity for a patient to empower themselves. This is particularly, i.e. those people who, for some reason, they find it a bit uncomfortable to come forward to have their testing done at the health facilities. So this is a great opportunity for this group of key populations. And also, this is also another options that we can give, particularly, I mean, during this COVID period time, what we're talking about the COVID time. So this is the opportunity for a patient or for us clients or subject to do their own test at home. So this is something which I feel that's very exciting. It certainly is going to boost up, especially looking for the missing million in the community. And we were talking about the challenges, the one that we have just now, including that a quite significant proportion, no matter how much that we try to reach out those key populations, but I'm sure there will be quite a number. For some reason, the stigma or whatnot, they will still remain at large in the community. So self-testing is definitely is going to make a change in terms of our effort to look for the to find all this missing million, and it will definitely going to be a complementary to what we have right now. I think this is something I look forward for what the self-testing going to bring to us soon.
Excellent. Thank you, Dato. And, you know, Dr. Doherty highlighted that the WHO self-testing recommendation has just been launched last week at IAS. And here Malaysia is one of the few countries in the world already moving forward on a hepatitis C self-testing study. So I think quickly, if you could maybe just highlight some of what you feel are the key enabling factors that allowed Malaysia to move so rapidly on this pilot study right after the recommendations.
Well, we have, as I mentioned at the beginning, I mean, our environment is probably perfect for the new tools like self-testing, which is coming in right now. Number one, that we have a very good teamwork. I know it was a bit difficult at the beginning, but I think with the leaderships and also with the coordination, so on and so forth, I think we have come up and we have proven that by working across collaboration, networking, and tolerating each other to a certain extent, I think this has made it probably the best recipe. So wherever the new innovations, and in this case here, where the self-testing going to come in, I think it will fit in nicely, and it's going to be another booster in terms of our work with the hepatitis C program. We have already an existing good teamwork. We have all the under the Ministry of Health, and also plus our CSO, the civil society organizations, and also the NDI, fine. So I've been working very closely, and we all have been trained already. So any new facilities, for example, like self-testing, I think it will be just another measure towards boosting the program for the hepatitis C. So I feel that, yeah, it shouldn't be an issue at all.
Great. Thank you so much, Dato. And thank you so much, Dr. Nazila. I really appreciate both of you sharing your key insights on this. And I think both brought up some really critical parts about the importance of community in this whole journey, the importance of the NGOs in maybe helping to facilitate those linkages and bring in people to the primary healthcare. And on that, it's a great pleasure for me to introduce Ms. Anushia, who is the Manager of Partnerships and HIV/HCV Special Initiative for Malaysian AIDS Council. Over to you, Anushia.
Thank you, Sonjal. Okay, so just a bit of background on the partnership between the government and NGO. Okay, the Malaysian model of government and NGO social contracting is well known regionally and globally in developing a strong network to reach out our key population for HIV epidemic. And definitely hepatitis C can be integrated into these efforts. So the collaboration between community groups and Ministry of Health on hepatitis C started to blossom in 2019 when the community came to the National Hepatitis Conference for the first time. Because before this, actually, only clinicians and also healthcare workers attended the National Hepatitis Conference. But in 2019, actually, the community group and also Malaysian AIDS Council, we also attended the conference. And that's the first time that we meet with Dr. Muhammad Razi, which is National Head for Hep C treatment program. So with this increased cooperation enables stronger services delivery with the community perspective in mind. Okay, then at the same time, in 2019 also, since we have a national HIV program under the leadership of Dr. Anita Sulaiman, the head of HIV, hepatitis C, and STI sector and Ministry of Health. Okay, so then we don't have any fund to run a program for key population for hepatitis C. So since we are serving the same key population, so Dr. Anita discussed with MEC and other NGOs, and they come up that since we are serving the same key population, so we can, whenever we send them for referral at the clinic kesihatan, they can also refer for other services like hepatitis C, STI, maternal maintenance therapy, and so on. So this really helps that even though we don't have a separate, a specific fund to run a prevention program for key population for hepatitis C, but we can use the existing HIV fund actually to run the program for key population. And most interestingly, when after by end of 2019, actually we managed to do a national hepatitis stakeholder meeting for the first time, with the collaboration with the multi-stakeholders, so be it from government agency, from NGO, from the community group, international organization, and on. So with that, actually, then internally, MOH had a meeting to actually, and after that, in February 2020, so decentralization of hepatitis C services had been happened. Before that, FIND already did the FIND study at the 4 clinics, and from there, actually, they expanded to more than 140 primary care clinics, 88 public hospitals, and 19 private hospitals that provide hepatitis C services in Malaysia. So this is in line with the concept of One Health for All, where whenever a key population or community go to a government healthcare clinics, so actually they can get tested for HIV, HCV, or any other health that they can, even though general health as well. So this is not only cost effective, but also time saving for our community to seek health services. So they don't need to come few times to the clinics to go for separate testing. So they just come one time, they do one test, and this is actually also cut costs for them. So because before this, when hepatitis C only available at the public hospital, so they have to put a lot of out-of-pocket expenses to travel and to get tested and treated. So now with the decentralization, it's really helped our community members to seek healthcare services with less cost and more time savings. And also evidence from the existing HIV and now emerging evidence from HCV has shown that differentiated service delivery is needed to reach as many as possible with hepatitis C services. Okay, so for instance, community-based testing. So currently for HIV, normally we with the help of Ministry of Health and to state health departments, we train our outreach worker to conduct community-based testing for their own community. So with that, actually, we can reach out more key populations. And for those who are, for those who are got fear to go to clinic, actually they come for the NGO and do the community-based testing at the NGO settings. And also for self-testing, be it HIV self-testing, and now with the HCV self-testing. So this is actually, we have 2. So one is CBT, which is we can conduct for the group who do not have smartphone, okay, do not have a good internet coverage, or so they actually can go for community-based testing. And for those who are good, means for those who have a smartphone, they actually can go for the HIV or self-testing at the website.
Anushia, I think you're on mute again somehow.
Sorry. Now?
There you go.
Yeah? Okay.
Yes.
Thank you. So for integration of HCV and other services into existing HIV platform, so MEC, okay, we have our own program, we call it a Jom Test program. So this is the first HIV self-testing website in Malaysia. Okay, it is a safe space for people vulnerable to HIV infection to do self-testing at their own comfort, send result, and finally link to care. Okay, this is initially designed for our own key population, but now even general population are interested to join this program. Okay, so actually what we can see that many people are fear to go to klinik kesihatan due to stigma or fear. So actually this online testing program is really good and will really cater to their needs. Okay, and with the integration of current hepatitis C self-testing study with the JOM test program, you definitely benefit our key population since they can do both HIV and HCV self-testing at one time. This really saves their time. It also expands their knowledge and awareness about hepatitis C among key population and general population as well. Okay, if you see knowledge, there's knowledge about hepatitis C is low among our community members. So as a MET, we always conduct training to our outreach workers and case workers at the NGO level to create awareness on hepatitis C. Because this we do at least twice a year or quarterly to our outreach workers member to increase knowledge so that they can share their knowledge with the clients, with the community at the ground. Okay, and many community members who are uncomfortable to go KKs now can do testing through the JOM test program.
Great. Thank you so much, Anushya. I think your insights and perspectives on community involvement are really critical to understanding how hepatitis C self-testing can fit into this larger journey of differentiated service delivery models. So earlier we had a bit of a technical issue, and due to that, some of Dr. Bill Rodriguez's remarks may not have been transmitted. Therefore, we'd like to invite Dr. Bill Rodriguez, the CEO of FIND, back on stage to say some more remarks on that. Thank you.
Thanks so much, Sonyal. And just let me know if you can't hear me, because the technical issues are possibly on my side. Can you hear me okay right now? Okay, great. I'll just abbreviate my remarks. So first, thank you to everyone for taking time today on World Hepatitis Day to join this important discussion, and a special thanks to our colleagues at the World Health Organization, at DNDI, from the Malaysia AIDS Council, the Director General, and the representatives from the Malaysia Ministry of Health. I just made 3 points in my initial remarks. So first, as many of you know, World Hepatitis Day as a public health campaign is only 10 years old. It was established by the World Health Assembly in 2010 to raise awareness and to educate everyone about hepatitis and to highlight the diagnosis, prevention, and treatment of the various forms of hepatitis, especially hepatitis B and hepatitis C. And World Hepatitis Day came about only because of the dedication of individuals and organizations working together with the leadership of the World Hepatitis Alliance to help the hundreds of millions of people whose lives have been affected by hepatitis, and now dedicated to the goal of eliminating hepatitis by 2030. FIND is the global alliance for diagnostics, and our mission is to ensure equitable access to reliable diagnosis around the world. So the types of partnerships and alliances that have led to World Hepatitis Day are also the cornerstone of FIND's strategy for improving access to hepatitis C testing and testing for other diseases. My second point is just to highlight how much your work here in Malaysia is a shining example of what can be accomplished through these partnerships. So through our partnership with the Ministry of Health, it's been a privilege to be a part of Malaysia's exciting and really profound journey in addressing the scourge of hepatitis C and demonstrating to the rest of the world how to confront, diagnose, treat, and ultimately eliminate hepatitis C. Every step that is necessary to bring better testing to the fight against hepatitis C has been done through close partnership with the Ministry of Health and other partners in Malaysia, from basic R&D, product development, clinical trials, and ultimately the creation of programs that can increase access to testing for all the people who are at risk for hepatitis C and its consequences. We've worked with the Clinical Research Malaysia team, CRM, to validate finger stick testing for hepatitis C on the Gene Expert platform. We've worked with the Ministry of Health on feasibility studies for hepatitis C self-testing. And we've collaborated with the Ministry of Health and DNDI to bring hepatitis C testing and treatment into primary care through the UNITAID-funded Head Start project. And third, I was just highlighting what the impact of the Head Start Malaysia program has been to date. An independent evaluation demonstrated the impact of an approach to hepatitis C that links testing and treatment in primary care settings. So first, it reduced the time that it took a patient to get a hepatitis C test result from several months to just 15 minutes. And second, it led to the treatment of more than 2,000 patients, which means that by 2030, 200 lives will have been saved, and the Malaysian health system will have saved 71 million ringgit, which is about $17 million. So we're privileged to continue to partner with the teams in Malaysia on this trailblazing study of hepatitis C self-testing. You've heard about how that will roll out and the importance of self-testing and expanding access to treatment. And we're confident that this will continue to advance the Malaysia hepatitis program and demonstrate to the world the leadership of the Malaysian Ministry of Health on access to hepatitis C testing and hepatitis C treatment. Meg Doherty highlighted in her remarks that the WHO had launched its guidelines for hepatitis C self-testing just last week. And today, Malaysia is really one of only 3 countries to already launch a hepatitis C self-testing study to understand how best to use these tests to treat this disease. So just to close, we all know hepatitis can't wait and Malaysia won't wait. And I just want to thank everyone for their remarks today, their effort on this program, and their participation in today's webinar. And at FIND, we look forward to continuing our partnership with all of you in our joint efforts to eliminate hepatitis C. Thanks, Danielle.
Great. Thank you so much, Dr. Rodriguez. Now it is my great pleasure to introduce Jean-Michel Pied-Daniel, who is the Director of D&DI Southeast Asia. And I'd invite Jean-Michel to help us understand bring together all of the important messages that we've heard today. Over to you, Jean-Michel.
Thank you, Sanjel. What I think, the main message is elimination of HCV will not happen without simplification and decentralization. And we know that for a long time. I think, WHO guideline and recommendation are clearly going in that direction, as Dr. Doherty was reminding us. And the fact that we have now self-testing, which is an extension of decentralization, it empowers patients. I think this is really a tool that we all need. Still a lot need to be done worldwide on both hepatitis C and hepatitis B. And the kind of partnership that we have seen here between the MOH FIND, but other organizations, us and MAC, we can see that has been real successfully catalyst in decentralization, treatment, and patients. And as Dr. Rodriguez was highlighting, alliance are and will be the cornerstone of hepatitis C treatment and elimination. And we need to see more of what we have done here in Malaysia, around the world. I think this study is really a great opportunity for Malaysia and us as partners to demonstrate this kind of alternative approach, this kind of alliances that will help meet public health challenges of the future. But at the end of the day, we also have to remember that, and I think that took Dr. Radzi and Dr. Nazrila, but also Anu, really exemplify the collaboration that is needed and possible to get patients treated. Their insight, was really very enlightening, very interesting. I think they really are confronted with the practical challenges that elimination entail. I think, Dr. Nazrila, you probably have touched many viewers with your openness and recognition that of the challenges for patients, whether they are perceived or real, it doesn't matter. They are still challenges, and how this can be difficult for them to access testing, and recognizing why self-testing is so crucial. So I think that was excellent, and for us, the NDI, FIND, WHO. At the end of the day, it just highlights why we exist, what we should be here for, and is to ensure that the doctors we have here, and the patients that are representing also by Anu, have the tools, the medicines, the screening that they need. And in the long term, for the future of the hepatitis C, we need more of that leadership, that innovation. It can come, that leadership should, actually, I was going to say can, but I would rather say should come from the global south and middle income countries. I think 10.3 Dr. DG Isham was very clear about that, and he was emphasizing how this whole HCV journey for Malaysia has been one of innovation, global south innovation. And that's really also unique in what we have done here in Malaysia. We find with the Ministry of Health and us. This innovation has to be practical, it has to be patient-centric. Not everyone will want to go to a clinic, and we need to find the missing millions. That's the biggest challenge, as Dr. Radzi was highlighting, in hepatitis C elimination. Where are those patients? I also think in the journey, in what we have gone through together in Malaysia, we can see that most of the tools are within grasp of Ministry of Health in low and middle income countries. The price of DAAs and screening remain high in some countries. We have to acknowledge that. It's still not as affordable as it is in Malaysia. And we need strong leadership. We need to have strong political leadership from government to create the condition of a competitive market pricing, not just in Malaysia, but in many other countries. That's what is needed now. Competitive market pricing so that we can see the price of DAAs and screening go down. We have to be, bold in the kind of leadership that and innovation that we want to create. And I think the old paradigm, relying on rich country to deliver that innovation, that is not just going to work anymore. South-South collaboration is, whether it's on HCV, but also on COVID or on dengue, MOH-driven approach, new ways to engage with patients. This is the future, and that will happen. That can be demonstrated in endemic countries, or low-income countries, middle-income countries. We need to do more of it. Find the NDI and other PPP. We need to work with these countries. Clearly, we need to create opportunities for innovation, as we have done on HCV in Malaysia, on other diseases beyond Malaysia, if we really want to reach the goal of elimination of hepatitis in 2030. We need to create new platforms with new solutions that put endemic countries in the driving seat. That's what has happened in Malaysia. The MOH was in the driving seat. And I think this is really why there has been so many changes and so much innovation happening. The social, political, and economical environment of middle-income countries is one of opportunities, new ideas, and I think there is more appetite for risks than in rich countries. And so that drives innovation. We have a lot of safeguards, whether they come from WHO, for example. There is a lot of safeguards, so we shouldn't be too worried about the risk that we are taking in bringing this innovation. I think the key message for me and what we have seen today is we need more innovation, and we need to use the enthusiasm and the potential of this new player to create that innovation.
Great. Thank you so much, Jean-Michel. I think that your encapsulation brought up several critical messages. The strongest being, we started today talking about how hepatitis C can ensure equity in hepatitis C self-testing, can ensure equity in service delivery and elimination. And I think you bring up another key important part about equity and thought leadership. Right. So I think the Malaysia example highlights how a global South, South-directed initiative can be impactful and long-lasting and have impacts, hopefully, across the region and across the globe. So we are a little bit over time. So I would like to thank everyone so very much for joining, all of our esteemed panelists, our keynote speakers, all the input and insight has really helped us to understand the next steps for the hepatitis elimination journey in Malaysia. So I would like to thank everyone very much for your attendance and wish you a great and wonderful day.